Today, let's talk about 10 common business questions and their answers that I receive for nurse practitioners on a regular basis. So, hello everyone. I'm Barbara C. Phillips. I am the founder of Nurse Practitioner Business Owner and Clinician Business Institute, and we've been teaching nurse practitioners about business, giving them resources, support for many years now, actually, since about 2007. And so today I'm going to go through 10 questions and some answers, my answers on some of the most common questions I get. Now, these are in no particular order. They're just the questions as I was thinking about this and seeing the questions that come in over and over again that I just wanted to put this out there. So, first question, can I? And this comes in a variety of formats. Can I start a business doing this? Can I see patients doing that? I think the most important thing here, and what I say most often, in fact, this is one I have in my queue right now to answer, is that you have to go back to your state. We all know that each and every state has a different scope of practice, each and every different specialty track that you might be certified in has a particular scope of practice. And each state also has different rules and regulations about starting businesses, particularly healthcare related businesses. So to find those answers for your particular state, you may need to go to your Board of Nursing, and in some states, maybe even Board of Medicine. So you want to make sure that you have done that. Now, regarding business, can I? In many states, it's business as usual, if you will, but in some states, it is there's some real hoops you have to jump through in order to start businesses. If you are a nurse practitioner, and in some places we cannot hire physicians if you happen to need a collaborating physician. So you need to know the lingo and the ways to jump through those particular hoops. So again, Board of Nursing for scope related issues, perhaps your national organization in terms of maybe age groups that you can see, or the different types of patients and clients that you can see and what you can do with them. And then, of course, Secretary of State in your state for types of businesses, business structures that you may or may not be able to do. And I will just give you a very clear example. Some states you cannot, as a healthcare professional, as a licensed individual, you cannot start an LLC. It has to be a PC or a PLLC. And then in one state in particular, and that's Michigan, Michigan does not consider nurse practitioners to be quote unquote learned professionals. And therefore you cannot start any kind of a corporate structure if you're going to do business. You're going to have to do it as a sole proprietor, which is the least advantageous business structure, if you will, that you want to be able to start. Question number 2, I'm an NP student. And how soon can I start my practice? I'm an NP student and I want to get started right away. I just graduated. Haven't passed my boards yet, but how soon can I start a practice? So I get a lot of those questions. And here's what I have to say. If you are a brand new nurse practitioner, then you need to work as a nurse practitioner in order to get strong NP legs, if you will. Just like you get C legs, you want to get NP legs. You need to be proficient in your clinical skills before you go and start a clinical practice. Period. End of subject. Now, is that true across the board? Not always. There's always exceptions to those rules. For instance, I once worked with a psych NP student who was actually a licensed counselor and had her own counseling practice for 10 years prior to going on to becoming a Psych NP. So in her particular case, she already knew how to work with people. She already knew how to run the business. And where she really needed help with was more on the medication side. And so she hired another Psych NP to act as a mentor for her and to be available to her. So if she had questions about medications. But for most of the other part of it, she was okay. So that was something that was different. I also worked with a couple of student NPs. They were just finishing their program, a husband and wife team, but they also happened to own a healthcare related business and had done so successfully for a number of years. And what they were planning on doing for their practice was, because they had the resources, they hired some seasoned nurse practitioners to work in the clinic and to also function as their clinical mentors while they were getting their sea legs under them, if you will, and at the same time being able to run the practice in terms of, having an office manager and that sort of thing. So again, there are exceptions to that, but I would say overall, if you are a brand new nurse practitioner, then you need to learn the art of being a nurse practitioner before you step out and do business. So number 3, let's talk about opting out of Medicare. One of the most common questions and the most misunderstood concepts out there is the idea of Medicare Opt-Out. So here's how Medicare Opt-Out goes. When you opt out of Medicare, that's opting you out, you as the individual clinician. So that is a global thing. That means you cannot go work for the federally qualified healthcare clinic down the street and have them bill Medicare on your behalf while you are opening up your cash-based practice where you have opted out. There's no such thing. It's not opting out of business. It's not opting out of practice. It is opting out you. So if you choose to opt out of Medicare, meaning that you cannot bill Medicare, then you need to be aware that you can't work anywhere else where they're billing for Medicare. And, they're not going to be able to bill for you. And also, when you do that, there's a lot of rules and steps and procedures that you need to make sure that you're following in your own practice if you're opting out of Medicare. We can do a whole session just on Medicare opt-out. So anyway, if you do have questions, there are some videos on our website. There are articles on our blog about opting out of Medicare. But in the meantime, please understand that once you are opted out, you are opted out no matter what. So question number 4, what is the best EHR? Which one should I get? This is so common, it's ridiculous. So there is no such thing as the best EHR, EMR, whichever terminology you choose to use. What you need to do is take a step back and look at what are your goals for your practice, for your EHR. What do you want it to do? Who do you want it to connect with? Do you want billing connected to it? Do you want billing to be a totally separate thing? Are you planning on using billing in some third-party software, or do you want it integrated? Who's going to be doing your billing, and will they easily have access to it? How easy is it for you to use that EHR? Is it intuitive? Is it not? What about your budget? And how much is it going to cost you when you start looking at that EHR for each and every person accessing those records? So you might have a medical assistant or an office manager or a biller or your collaborative physician. Is it going to cost you to have those people access the EHR? My best advice is for you to look at what you are currently using. What do you like about it? What don't you like about it? How does it fit your particular workflow and how that you work with your patients? And then go out and start testing different pieces of software and see which one fits. Again, you need to keep this in your budget. It needs to have the bells and whistles that you want, and it needs to fit your workflow, because there's nothing worse than having a system that is difficult to use, that slows you down. We've all been there, and you certainly don't want that in your own practice. When you go out and you start asking different people which EHR is best, you're going to get 100 different responses, if not more, because everybody has a different way of working. They have different EHRs that they like. And quite frankly, some people also get a referral fee if they can get you into even a demo on a particular software. So you need to be aware of all of that. So what's the best way to start a practice? What should I be doing first? And this is a great question, and I wish more people would actually ask me this question, because oftentimes we tend to see people who have put the cart before the horse and have just jumped in and missed some essential steps. So the first thing that I believe that you should be doing is just take a step back, take a deep breath, and really look at what you're considering doing. Have you looked in your community? Have you looked online? Have you actually looked at what it's going to take you to start a practice? Do you have the support that you need at home to start a practice? There's nothing worse than trying to do all this work to start a practice when you have a partner at home who's just like tearing it down all the time and telling you you can't possibly do this, or complaining that you're taking time away from the family because you are out trying to start a practice. So you need to bring all the stakeholders on board. You need to do a thorough evaluation. There's many, many examples of SWOT analysis online. That's SWOT, for strengths, weaknesses, opportunities, and threats. And really take a look at what it is that you want to build and what some of the obstacles are. Take a look at your rules and regulations for starting businesses in your state. Look at your scope of practice. Look at the resources that you have available to you. Well, you should also, one of the first things you should be doing is starting a business plan, even if you're not sure you're going to go forward, because this helps you do that research that you need to do. You need to figure out the finances up front as soon as possible to even see if it's a viable idea. So again, the whole idea for me is to tell you to take a step back and breathe. Now, the other thing is a lot of people are saying, well, can I go to Small Business Administration? Can I go to SCORE? Can I do these things? And yes, you can. And they're great at helping you and giving you resources on business. But what they don't have is they don't have information on starting a practice. It's going to be rare to find somebody in your local SCORE or your local SBA that can guide you through some of the pitfalls that you're going to have in the healthcare arena. So you need to keep that in mind. And often you may want to seek assistance outside of that area. What kind of financial assistance is available to me as an established practice owner during this whole COVID-19? You know, what's available to me? Well, early on, I know many people heard about the payroll protection plan and the economic injury disaster loans and that $10,000 that you could get up front and not have to pay it back. Well, some of those programs are no longer available. there is no early payout anymore, or no grants that they were giving. Those are all gone now. And that actually came to somebody. I called the SBA and asked them about that. And so, no, that's not available to you anymore. However, the economic injury disaster loans you can still apply for. Those are the loans that they'll give you. It's really easy to apply. The interest rate, I believe, is 3.75% at the time of this recording anyway. And what I'm going to do is I'll put the link below so that you can take a look at that particular. Also, SBA has another page of some different resources for loans and other monies for your small business. Now, I will want to warn you, if you look at the economic injury disaster loans, that money has to be used for operational expenses. It cannot be used for you to go out and buy a new space for your clinic. It cannot be used for you to expand to a new building. It is to be used for operational expenses. So, for instance, if you weren't able to pay rents, if you need to pay payroll, if you're behind in some of your payments for maybe equipment or something like that. So you want to be careful and look at how you are going to utilize this money. What do you really need it for? And be aware that it's not free money. It is, like I said, 3.75%. And I believe the loans are like 30 years or something. So it goes out over a period of time. So you may want to take a look at that. There may be other grants in your local community. And of course, this whole thing can change very quickly, because this whole situation with the coronavirus and how it's impacting healthcare, how it's impacting communities across the country, across the world, that is continuing to change. So just keep your eyes out there, but the SBA.gov has been the place to go for most of the resources for your business regarding this. Question 7, collaborative physician. I need a collaborative physician. How do I find a collaborative physician? What kind of a agreement do I need? How much is it going to cost me to have a collaborative physician? What are they supposed to do? Do I have to have them sign off my charts? So a lot of these questions are going to come from your state rules as far as what that collaborative physician needs to do, how often that physician needs to do whatever it is that they need to do. Another common question that we get is, I'm in California, can my collaborative physician be in Florida? Well, again, you need to go back to your state rules regarding that. In some cases, that person can be out of state. They likely need to have a state license for the state that you're working in. So again, that's going back to those rules. Now, what if you can't find a collaborative physician? This comes up frequently. And the thing to take a look at, one of the things that I have seen work really well, is if you've networked your community, your colleagues, nobody is available, you can't get a referral for somebody who might be available, that sort of thing. One of the things that has been working for a lot of nurse practitioners is to place a job on Indeed, INDEED.com, and that's been working for a lot of people. Now, regarding the money that you're paying for collaborative, start doing, just like with any business, a market research. Find out what others in your community are paying for. You need to make sure that this is something that is within your budget. I have seen nurse practitioners pay $5,000 to $7,000 a month, which is completely inappropriate, and it's non-viable. It is just not viable. So you need to look at the entire picture. What's the going rate in your community? What is that physician supposed to be doing? And you need to make sure that you're able to support that. I also do not recommend that you go for percentages, because as your practice grows, that percentage becomes higher and higher, and it can really impede your own growth in the business. So I would not do that, but always have a collaborative practice written agreement. And we do actually have an ebook available at Clinician Business Institute on how to write a collaborative practice agreement and some things to take a look at when you are doing this. And that link is just at clinicianbusinessinstitute.com. Okay, the next question, where do I get the money to start my practice, to start my business? How do I take a look at this? Well, again, this is one of those areas that we have several blog articles on over at npbusiness.org. But many people start off with the first thought is, well, they must have to borrow money. But I will tell you, if you don't have to borrow money, do not borrow money, because that's only money that's going to go comes right back out of your pocket, and it'll take you a longer time in order to make the money that you want to make in your business. Take a look at really what is it going to cost. For most of us, we overestimate in the beginning what it's going to cost us. In fact, I did that because I had no resources when I first got started in this, and I was reading journal articles, magazine articles about physicians starting practices and it costing $100,000. Well, no, it doesn't need to cost you anywhere near that. Many nurse practitioners have started businesses for under $15,000. So it just really depends on how you're going to put that together. But you can certainly start with your savings. Maybe you'll take a loan out from a friend or family. You may or may not be able to get grants. Those are harder to come by in terms of getting started in your business. If you are going to go for a bank loan, you must have a great business plan and be able to show how you're going to make that money to be able to pay back that loan. So, take a good hard look. This is going back to in the beginning when I said do some planning, do an assessment, and see what you absolutely really need in order to get started. What kind of practice can I start? Well, that's what kind of practice can't you start? It certainly has to be within your scope. So that's a no-brainer. It has to be within whatever rules might be in your state and how you incorporate it and structure it. Basically, you can start a practice that is within your scope. But, think about the ethics of it. And this is something that has come up because I've had some conversations with folks who work with the National Council of State Boards of Nursing with some of the ethics that they see happening. So what is the goal of your practice? Who are you going to serve? And how are you going to meet those needs? If your practice is simply about how much money you can make. And one of the examples that one of the folks gave me was the practice whose sole purpose was to go out and deliver IV therapy after a weekend of drinking and football games at a college. And right now we're certainly not at football games, but you need to take a look at how sustainable your practice is and what is the goal that you're trying to do. So if you are, for instance, though, again, going back to scope, if you are a pediatric nurse practitioner and you want to take care of adults, well, that's outside your scope of practice. I get a lot of family nurse practitioners that ask me about starting practices dealing with depression and anxiety. That may or may not be within your scope. And because obviously as FNPs, we often see that in primary care. but you really need to clearly define what it is that you're going to be doing and when you're going to be referring out. So that, I would say, go back to your state board of nursing. But basically, I see nurse practitioners starting all kinds of clinical practices in every specialty, depending on the experience they have. I do see all kinds of nurse practitioners starting cosmetic dermatology. They're starting procedure-based practices. But beyond your typical types of practices, I also see NPs starting other kinds of businesses. So the sky is the limit. Just looking at scope and rules and regulations in your state. And number 10, what does insurance reimburse nurse practitioners? So I get this a lot where people want to figure out their fee schedule and how much they're going to make. And of course, that's a great question because you need that information when you are trying to put together a business plan, when you are trying to answer that financial question. Is this financially viable? Is this feasible? Should I move forward in doing this? So commercial insurance reimbursement rates are considered proprietary information, and so they do not share those with just anybody. And in most cases, you'll see once you have a contract with that insurance company that they actually forbid you from sharing your reimbursement rates with other clinicians. And I have a lot of feelings about that myself, but that's the way that it is. So one of the things that you can do to find reimbursement rates is with government agencies. Medicaid, Medicare, workers' comp, all of that information is public information. And so you can pull those fee sheets right off of whatever, for instance, you can go to the Florida Medicaid, you can go to Washington Medicaid and pull down the fee schedule. You can go to your local Medicare area contractor. So for instance, when I was in Seattle, it was Noridian. So you can go to whoever that is and you can pull down the fee schedule for your jurisdiction. What you need to be aware of when you start looking at those is that with Medicare at this point in time, the fee schedules, the reimbursement schedules that are listed are at the physician rates. And in most cases, nurse practitioners only receive 85% of what the physician gets. That's the Medicare allowable. So you'll want to be aware of that when you start figuring that out. The other thing is for Medicaid, for workers' comp, that's going to vary state by state. So in Washington state, for instance, nurse practitioners get 100%, but in other states, they might just get 60%, 70%, 90%. So you need to take a look at what it says in your particular state. That way you can take a look, figure out if I see these patients, this many patients at a 99213, at a 99214, this is what I'll get reimbursed. And if I have this number of patients, then will that cover my estimated overhead? So it's really important to have that information. The other thing that I see a lot of, and actually one of the nurse practitioners I work with recently, they received a contract from one of the commercial insurers who was paying less than Medicare. So the other thing when you get things like that is remember, you don't have to accept every insurance contract. Let me say that again. You do not have to accept every insurance contract. You can send it back to them. You can renegotiate. You can say thank you, but no thank you. I will not be seeing these patients. And you can also get your patients involved if you're not getting the information or the rates or even the willingness of that insurance company to work with you. So I think this has probably gone on long enough. That is 10 of the most common questions that I receive. But believe me, I can do another 10 and another 10 and another 10. There's so many questions that people have. So again, You can find a lot of information on our blog at npbusiness.org, and that blog has been regularly published on since 2007, so there's a lot of information there. You can also take a look at our website, Clinician Business Institute. We have a lot of courses available on billing, on collaboration, on credentialing, and also just the whole package of how do I start a business? So you can take a look there as well. So I hope to see you around. If you've got any questions or comments, please leave them below the video. Otherwise, I'll see you online. So thanks so much for taking the time to listen, and have a great day. Bye-bye now.